Is the department or the government aware that people with chronic mental health conditions are resorting to afterpay to pay for services? And I provide a copy of an article referring to that. I'll give that to the Secretary if they want to provide copies. But recent story in The Australian, it was the 12th of May 2024, desperate Australians have turned to buy now and pay later platforms to access the treatment they need from a psychologist or a psychiatrist. Is that appropriate?
Senator, I might respond by just reinforcing some of the free services that the Australian government is investing in.
That's not what I'm asking about. People are resorting to afterpay to access a psychiatrist or a psychologist, and these people don't need free early intervention services. These are people with acute chronic conditions, mental illness, are resorting to afterpay to pay for psychologists and psychiatrists. My question is this appropriate?
Well, I think the responsibility on the Commonwealth is to make sure that there are services that are funded and available to people who have various health conditions, of which mental health obviously is one of them. I would say that, and I didn't make this point earlier, but I'll make it now in relation to mental health funding, there were a number of programs that were terminating under the former government, one of which was the psychosocial support for people with severe mental illness who were not in the National Disability Insurance Scheme. That funding just stopped, just ended. Nothing ongoing in the budget for that. So I think under the former government there must have been a belief that people were just miraculously cured on the 1st of July. That funding has been reinstated in an ongoing way because it's not a terminating program. So our responsibility is to make sure that there is a suite of services along the mental health spectrum, from free services for low intervention right along to more intensive supports for people with more severe mental illness and everything in between. But we cannot say that people will still not want to supplement that or make their own financial arrangements about accessing care. Our responsibility is to make sure the system, which is under pressure, is doing as much as it can so that people have access to services and that they are supported through the Medicare system.
So can you please outline for me your logic in cutting the better access to mental health care plans?
Well, we have discussed this at estimates.
Well, let's discuss it again.
Yeah, well, we can discuss it again. And that was, and I think when you look at the data, and I'm sure someone will bring it up, about repositioning that program so that people who did require that level of intervention were able to get it.
How?
Because one of the things that the review found was people who had needs for more severe, more intense interventions were missing out because people were accessing that program who had, who required less intensive support because there's only so many appointments. And so that was the whole point. And that's the point I make more generally about the mental health system, is you have to have interventions at that end and at that end, and within that you have to make sure that the resources are allocated so that they reach as many people as they can at the appropriate level.
I think you might need to get a briefing from Minister Butler's office on what the review actually
Don't patronise me,
Senator Gallagher and Senator Hughes.
Don't patronise me.
Senators, I'm providing an indication